Hi everyone, my name is Bayle Conrad. I'm a program coordinator at Harborview Medical Center, and this is step 2 in the SSI process for newly arrived refugees, and we're going to discuss completing the online disability application in this presentation. So once you've scheduled an interview with the Social Security Administration for your client to apply for SSI benefits, the next step is to fill out an online disability application. While this can be time-consuming, this step is important in making sure Social Security gets the correct information about your client. It also helps the actual interview go much faster. If you are unable to fill out the online application before the interview, all of the questions will be asked during that process. However, I have found that filling out an application beforehand makes the entire application process for SSI go much smoother overall. So let's go over some tips for information to gather before starting the online disability application. Knowing the basic demographics of your client, the health conditions that they've been diagnosed with, and the information for the health clinics that they have attended before starting the application online can be really helpful. You're also able to save and return to the application if you find that you don't have all the information. We're going to go through what the application includes so you get a sense of what type of information to ask your client before starting. But those 3 categories are sort of the basic things to know. Another tip is to try to get as much medical information from your client before starting the application. So asking your client if they can bring in any medical paperwork they've received. I've even in the past been able to have a client sign a release of information so that I receive the medical records directly from their clinics if they're okay with that. Having any sort of medical information can be really helpful to making sure that you're filling out the paperwork as thoroughly and fully as possible. And then a final tip, and we'll go through some of the application in this presentation, but downloading a copy of the PDF version of the application can be really useful so that you can actually go through it with your client if they're unable to be there as you're filling it out online and ask all of the questions needed. So a few other notes about filling out this application. The first is that you are able, as the caseworker for your client, to fill out the application online and to submit even if your client isn't currently with you, which can be useful if you are trying to complete the application in segments and you're saving it and coming back. You don't necessarily know when you're going to submit, so the client might not be with you. If you select that option, then Social Security will just verify the information that you've provided with the client and have them sign at a later point stating that the information is correct. The most important information to enter at this point in the application process is the medical conditions that your client has been diagnosed with and any medical clinics attended. And that's going to include the addresses and phone numbers of those medical clinics. The reason that piece is really important is because Social Security uses the medical records of your client to help them determine if they meet the definition of disability. And they do that by directly requesting those medical records from the clinics that your client has attended. So if you don't list the clinic at this point, Social Security will never request those medical records or even know that your client has attended that clinic. Another note is using the notes section at the very end of the application can really be to your benefit. I would encourage you to always make a note that says something about your client being a new arrival to the US. You can list their immigration status and making a point to note that they might not have full medical records or a full medical history, especially prior to their arrival in the US. You can also list things at this point like that they don't speak English, and so you're helping them with this process. And if there's anything that you've estimated or, had to use your best guess with your client's help throughout the application, you can list that here too. So that might be something like if the application asks for a date of marriage, some clients might not have an actual date or might not know an actual date. And so I've had clients who have literally given me a year, and I've listed here at the notes section that this was estimated. There might also be portions of the medical information that's estimated or unknown. We'll get into slides in a bit here that go through kind of the types of questions that are asked, but one question that is asked is the first time a patient was seen at a specific clinic or the last time that they were seen at a clinic. And I've had a lot of clients who don't actually know those dates. They might not have the records with them. They might just know that they've attended that clinic. And so you can also add in that those are estimated dates. And so just adding in that context at this point can be really useful. And also it, makes sure that you're providing Social Security with the most updated information as possible and really making it clear when something was estimated, so that if they find out at a later point, for example, that the date that a client saw a doctor was not what was listed at this point, you have clearly written out that some of the dates were estimated because your client couldn't remember when they have seen a doctor. So I want to spend a little time just going through how to actually access the online disability application. This is updated as of May 2024. So there will be a link at the end of the slide for how to access the application. And it'll take you to a page that shows the following. And you're going to just click on Learn How to Apply first. The next few pages will look like this. You're going to want to select if you're applying for an adult or a child. You are going to want to select what SSI program you're applying for, if it's just SSI disability or if it's SSI based on age, and you can see all this in the left-hand side of the slide. And then you want to make sure you select disability when it asks any other benefits you want to apply for. If you don't select disability at this point, Social Security will think that you are not applying for SSI at all for your client. So once you've made those selections, you can click on Learn How to Apply. Then the right-hand side of this slide will pop up. It's going to just review and summarize the answers that you had put in from the previous page. And you're going to click on Start Application at that blue box at the bottom of the page. Once you've clicked on that Start Application box, you can see on the left-hand side of this page, you're going to agree to the terms of service for using the system and click on Next. And then you'll come to the page you see on the right-hand side of this slide, and you're going to click on Start a New Application, which is circled in red. Once you've clicked on the Start a New Application, one of the first questions that Social Security will ask is about who is completing the application. This is one of the points where you can select that you're helping someone who's not with you and can't sign the application at this time. That will sort of inform Social Security that they will need to have your client sign the application at a later point in time. So now let's look over the application questions in the disability report. So on the next few slides, I'm going to go through all of the questions in the disability report. This is the PDF version of the report. Ultimately, what you're going to do is you're going to submit all of the answers to these questions in an online form on the Social Security website. But I found in the past that actually looking over the PDF version of the questions and making sure you have all the answers, or you ask your client all the answers prior to that submission, can be really helpful. Another thing to note here is that this form has been recently updated. So if you have used this form before or you're somewhat familiar with it, there are places where the questions have been changed. They've added some sections, so it might look a little different from what you're used to. So I'm going to spend the next few slides going over this report and then highlighting some sections that might be useful for you. Starting out, you can see on the left-hand side, it starts with basic information about your client. Section 2 asks you to list a contact that can help your client with their claim. This could be a family member or a friend. It could also be you as their caseworker. One thing to note about this section is anyone you list here will likely be contacted later on in the SSI process to provide additional information about the client. You will likely be sent a form asking for your perspective on their daily tasks. So making sure that whoever you list here is willing and able to respond to any mailing they receive from Social Security is important, just to make sure that your client has as much chance as possible to be approved for their benefits. On the right-hand side of this slide, you can see that Section 3 starts to ask about medical information. This is just asking you for the diagnoses that your client has. This is where it can be helpful to have copies of their medical records or to have received their medical records directly if you've signed a release of information for that clinic. And then you can see I've highlighted a section at the bottom of the right-hand side under work activity. And it asks a question: if the person has never worked, when do they believe that their condition has become severe enough to keep them from working? The reason I highlighted this question is it can be a little bit tricky to answer if you're working with new arrivals, particularly. There might be cases where your client does know when their condition became severe enough. For example, if it's a condition they were born with, if they had a specific accident or incident and they know the year, you can list that here. If they don't really have a great idea of when their condition became severe enough, or they're not sure, you can always list the date of arrival to the United States here, and then explain that in the remarks section at the very end of the form. The reason I say that is because that's really the date that Social Security is going to begin to see a medical history, unless your client has significant paperwork from overseas clinics. So it's okay to estimate as the date of arrival if you're really unable to list any other date here. So then the form continues to ask more about work activity and when their condition may have changed the type of work that your client was able to do. And then it goes into some questions about education and training. I know a lot of overseas countries might have different education systems, so you can do your best to estimate here. And again, you can note any estimations or anything that needs to be explained at the end of the form. There's space for that. On the right-hand side of this page, there's a couple of questions about the written language that your client might prefer. And this is a really good place to make sure you fill out completely, because if your client is only literate in their native language or illiterate in all languages, if they use a different language than English, this is something that SSI will take into consideration in terms of adding all of the pieces together that make it likely or unlikely that your client can find work. And so really trying to get this section completed thoroughly can be really helpful to just sort of adding the context to all of the other information that you're providing about your client. So one thing about this form that's important to know is that some sections will not be applicable to your client depending on their past history. And you do have to read the form carefully to make sure you're completing the right sections. So in section 6, you'll see at the top of the left-hand side of this page, you're only actually supposed to fill out this page if your client had only one job in the last 5 years. If your client had multiple jobs in the last 5 years, what's going to happen is you don't need to fill out this section, but they will likely receive in the mail after their SSI interview what's called a work history report that asks these questions of every single job that they held in the past 5 years. And you can see, looking at this slide, both of these pages ask some pretty detailed questions about all of the jobs that they've had. So if they've only had one job in the last 5 years, fill this part out. If not, you don't need to fill it out at this point, but it's good to keep in mind that you're going to likely have to help them fill out a much more detailed report about each of those jobs. And you can see here on the right-hand side, there's a lot of questions about the physicality of the job and the things that they were required to do in that job. And so just being prepared that that's likely a form you will need to answer in that scenario can help set you up and set up your client to getting that in a timely manner once it's sent. So continuing on to this slide, like I mentioned on the previous slide, this section 6 only needs to be answered if your client had one job in the past 5 years. I want to highlight the question 6D, which says, explain how your medical conditions would affect your ability to do this job. So either you might fill it out at this point, or if your client did have multiple jobs in the last 5 years, you might be sent a work report later on. But this question is really important to answer because basically what Social Security is asking is, okay, you were previously able to do a specific job that you just described. Now tell us why the current medical conditions you have make it so that you're unable to do that same job. This can be a really powerful statement for you to really write out some thoughtful answers for the limitations that your client now faces that they maybe didn't in the past. And then one thing to note here too is if your client did not work in the past 5 years at all, you simply just will not fill out this entire section and you will not receive a work history report for that client. So sections 7 and 8 start to move into more information about medical treatments, medicines, where your client was seen, what clinics they were seen at. This section can be difficult to fill out because sometimes clients might not know, for example, in section 7, the name of their medication, who prescribed it, why they're taking it. You can do your best to answer these questions. You can, if you're visiting a client at home and trying to complete this form, you can ask to see their medication bottles. If they have any medical records, it'll be listed there. If your client really doesn't know the medication they're taking, again, using the remarks section at the end of this form to explain that they don't know can be really beneficial. And then moving on to the right-hand side of this page under section 8 with medical treatment, this is really one of the most important sections on this form that you can answer. And like I mentioned before, what Social Security will do is they're going to take the names of the clinics, the providers, and look at their contact information and then contact them directly to get the medical records from those clinics for your client. So even if you don't know, for example, what medical conditions they were treated for at that clinic, that's part of, you can see in 8A1, that's part of the question. That's okay. just making sure that you have the name of the office, their phone number, their address, and then estimated dates when the client was first and last seen and the date of their next appointment is really important in making sure that Social Security does actually request those records. If your client doesn't know the date that they were last seen, the date they were first seen, or they don't know if they have an upcoming appointment, you can list the date first seen as their date of arrival in the US to just make sure that Social Security is able to gather all of the records. And if they don't know if there's another appointment, you can put unknown, or you can put an estimation if you think they might have one. And again, using that remarks section at the end of the form to add in any details if you've estimated or weren't sure will just help Social Security understand what was estimated versus what was known. So essentially, you're going to fill in all of the clinics that your client has been seen at. Again, knowing that if they've been seen by a clinic and it's not written here in this section, Social Security will not know to request the records on behalf of your client. So making sure that you do a really thorough job of listing all their clinics is really important. You'll then come to this section around medical treatment, and this is about tests that your provider may have ordered for you. This section is something that clients I've worked with in the past really struggled to answer. They might not remember the type of test they've had. They might not know what provider gave them that test. They might not know the date of the test. They might think that they've had some sort of heart test, but they don't know exactly what it is. This is another section where you can do your best to answer as thoroughly as possible with the information you have, either from, asking your client, seeing if they have any medical paperwork, or even requesting those records yourself. If your client really has no idea or can't remember, or you're estimating that you think they've had something done, again, listing that in the remarks section at the end will be really useful, because it will tell Social Security, that maybe this section wasn't filled out, not because your client hasn't had any of these tests done, but because they just don't remember or don't know. Again, Social Security is going to get the actual records directly from the clinics, so eventually they will see which of these tests have been done. So not knowing the answers to this isn't going to ruin the claim in any way, shape, or form. It just helps them understand at an earlier point if your client does know. And then moving to the right-hand side of this slide, Section 9 and 10, you generally will not be filling out for new arrivals. Section 9 asks if there is other medical information that Social Security might be able to gather from other places like the Department of Veteran Affairs, different social service agencies, vocational rehab agencies, prisons, things like that. More than likely, your client will not have any records from those places if they're new arrivals. And then in Section 10, you're only to complete that section if your client is already receiving SSI. So finally, at the end of this report, there is a section where you can list any remarks around things that were estimated, anything you need to explain further, or that you didn't have room to answer thoroughly. I know I've mentioned this section several times throughout the report, but this can be really useful, and you can use it to add some context that might be helpful to provide to the Social Security representative who's looking over the claim. I think there's kind of three things that I generally try to note in this section. Number one, I always would try to note my client's immigration status and the date they entered the United States, no matter what, in any notes or remarks section provided in the Social Security process. This just continually reminds Social Security and provides that context on every single form that they're a recent arrival, they have an immigration status that qualifies them for SSI, and that they're eligible for those benefits. And the other reason why it's important to list this, and kind of a second thing that I always try to note in this section, is that your client might not have medical records from prior to their date of arrival in the US, or they might have limited overseas records. So if, you're working with a representative who has never, worked on a claim from a new arrival, they might be really confused why, for example, if you said that your client has had this condition since birth, why does their medical history start a few months ago? So I try to just make a statement in the remarks section that basically says they're a recent refugee, they arrived in the US on this date, and they don't have any medical arrivals prior to that date. Their medical history really starts once they entered the US. And then finally, I like to clarify the points in the report that were estimated or unknown. And you don't have to go into great detail. For example, if your client didn't know the dates that they were seen at any of the clinics they've been seen at, you can just list that out and say, dates seen at all medical clinics were estimated because John Smith, my client, didn't know, when he had gone to each of his clinics. But, this is the date of arrival, so this is the earliest he would have been seen at a clinic. If some of the work history was estimated, you can just note that it was unclear to your client how many pounds they lifted and how frequently they lifted that many pounds. That's one of the questions that's asked in that section. Just really being able to clarify anything that was estimated can be really useful to Social Security in case later on in the process more information comes out, or maybe they gather the medical records and it doesn't match exactly with what your client has said, then you have this explanation here that something was estimated or unknown. And then finally, on the right-hand side of the page, it asks at the bottom, who's completing this report? You can list yourself and your relationship as either their caseworker or authorized representative, and that's really the last part of the report.